Rosa. I have to go over this again because the last video.
Let's say quick.
So let's quickly go through this. So we have kidney is bad, dirty blood. Ammonia and urea increase, so we have increase of fluids, which leads heart edema, swelling extremities, distended neck vein, crackles in the lungs, high blood pressure. Fluid is increasing, so we also have low Na, high potassium, high phosphorus, low calcium. You get the pictures later. And then we have TNS disturbances, which we have altered low level of consciousness, and we'll have restless legs, and we'll have seizures, because when you're confused, think about yourself, you're drowning in your own body because your body is not removing enough fluids. So what happens? You're like restless, you're not feeling okay, it feels like everything is going to go to an end, you're anxious, you're not settled, right? So that's done. So this is just a precursor of things that happen. So if your blood is going wrong, think about everywhere your blood goes to. So everywhere your blood goes to is going to be affected. Your brain will be affected, your heart will be affected, especially your heart will be affected. Especially your heart. Your digestion won't be.
Pericarditis that we talk about all the time.
So also now we have dirty blood. Not only that, your digestion is a mess. So now we also have, kidney is bad. We also have GI issues. Now, as a nurse, we need to think about what our patient is going through, right? Their breath smells like urine.
Uremia fetor thing? Uremic fetor or something like that?
Yes, uremic vector. Their breath smells like ammonia. Now, imagine the ammonia stays so, like your blood is not filtering, so your body has saliva, right? Where does the saliva come from? Fluid. If your fluid is tainted, what happens? Your taste is off, so you have metallic taste. And then because of that, since your body is not perfusing properly, and your mouth is basically full of all these weird chemicals. Mouth source.
That's what the uremia. They get the mouth sore when they get the immunosuppressant too. Right?
Exactly. So if there's small fluids in your body is not working properly, you have mouth sores. So what else?
Nausea and vomiting.
Anything wrong with your GI system?
Because of the acid building and the thing and the.
So I saw you say constipation or diarrhea. Your body is not settled, right?
They have constipation too.
It's constipation. It goes to constipation or diarrhea. Depends. So, but your pooping habits will not be normal. So I'll just say add. Instead of me writing constipation or diarrhea now because somebody can memorize it wrong. We can both memorize it wrong and it's not help us, right? Is there any cleaner? Can you imagine?
Hey. So let's use some mask cleaning.
It's okay, I'll figure it out.
You're not going to be using your hand to clean over and over.
I don't poop. Let's just say poop. Right?
Yes.
The raunchier it is, the more we remember it. Okay? So think about what happens. So now, you now have muscle cramp and muscle pain. Right? Because remember, what else also affects the kidney? Now let's think about the drug statin. Let's think about it. Because when you think about the things that can hurt your kidneys. So if you're thinking NSAIDs, what happens? Okay, or statins. Statins is a big kidney issue drug.
Why?
So what is one thing that you ask the patient to tell the doctor when you're taking a statin?
What to tell the doctor when they're taking statins?
Muscle pain.
Okay. That's a side effect?
Muscle pain is an adverse effect.
Usually
a complication of statin.
Okay.
No, metformin is also an issue, but statin is also a big one. Right? So because why? What happens? Because your stomach, your muscles will start breaking down.
Already your muscle is low.
Exactly, with your statins, right? And then your muscles start breaking down. And if there's too much creatinine, your kidney can't process it. Guess what? rhabdomyolysis, right? So you now have the signs and symptoms of rhabdomyolysis because there's something wrong with your kidney. So what do
So
we
the
have?
statin is a cause for that, or
The statin is a complication of statin. So that's why I was bringing it to think whether you to help you to jog your memory, right? So I'm gonna go back. You go down here, and we say musculoskeletal. Right? Let me squat. Okay. So we now have pain.
so rhabdomyolysis would be the muscle breaking down in the blood.
So, but like, just imagine if your muscles always break down anyway. Every single time that
But
they always break down. That's why if you're on your bed for a long time, you lose weight or you lose muscle mass, right? So they're always breaking down. Now imagine if your kidney was not even clearing up the breaking down in the first place. So your body, your muscles are cramping, you have bone pain, right? So I just say pain and cramps. Think about pain and cramps. And if your calcium is low, what happens? Your bones have an issue. And then you have food rot because your body is not working. So let's put it this way. Let's say
the food rot is from the calcium.
no, your let's think about this. Your joints and your muscles are not working as well as they are. So the thing that will hold up your food normally is not holding it up anymore. So it just drops. Alright? So we talked about pulmonary a little bit. Right? Talk about pulmonary a little bit. So let's think about it. When you have crackles in your lungs, let's go here and say lung, right? You're gonna hear crackles. When you have crackles in your lungs, what do you think SOB? Right?
Yeah. Chest pain.
Can't cough. Do you know how important coughing is? What do you do to your patients when they're in your bed?
Like deep breathing, cough, and all those stuff. Yeah.
Right? So they have tachypnea. Right? I will have Kussmaul type respiration. What is Kussmaul type respiration?
Breathing fast, I think.
Google it.
I did though. I have to remember.
Oh, we have this.
Okay. Labor breathing. Deep labor breathing. Yeah, oh my god.
Right? And trust me, when all this is going on in your body, what's going to happen? You're not going to be able to reproduce. Not even by your body, your body has not realized the reproductive system is not important.
Yeah, because
whatsoever.
It will be thinking about the major things first.
Okay, I'm not listening to stuff.
It's stopped?
No, it's not stopped. So reproductive. What happens? Low libido. Try. It's not easy.
Look at you. You didn't say anything about the others when you got there. Why are you cute? At least they don't have to fight for anything. They don't feel it. You know, it doesn't disturb them. Yeah.
You don't know how it disturbs them. You're married. You don't know how it disturbs them. Just imagine if it's you that's going through what your husband is going to go through. Please. You don't know how many arguments will happen. So that means you have to also go through couple counseling. Anyway. So infertility. Yeah. Your body is not going to let you have kids in this situation. Your body cares about your children. Your testicles.
They will shrink. They become small like
Listen, the word is
there's nothing there anymore.
No, man, I'm going to remember this. Like the way you said they will shrink. The way you said it with joy.
You know,
just will shrink. Okay.
Once you get married, it's just like
You want it to shrink.
Yeah.
Anyway,
Trust me.
God forbid that
I'm telling you.
Okay, so now think about all this is happening. What happens to your skin?
Yes.
We
Right.
have bronze skin color, right?
Yes.
Brittle nails.
Yes.
Your skin is not gonna look good.
It's just the whole body too.
So it's gonna be dry and flaky. With all this fluid, you think that you know.
It's just the fluid that does all those things.
And you're gonna have like crystallized your
Like
skin,
on
it's just
the
gonna be
skin.
itchy. Right? You're gonna be itchy. You're gonna have purpura. You're gonna have ecchymosis, so just bruises everywhere.
Because it's inflamed.
Exactly. Everything is just now.
You don't feel good.
No, I didn't write everything that's in the textbook, so
Like,
but this is what you need to know because most of it makes sense with the other.
Yeah.
So when you're not thinking about, oh, I have so much fluid in my body, my heart is not working well, everything is, I'm tired, I'm like, ugh, it's so. I even talk about the brain stuff. You're tired. You're like, you can't have sex. You're tired. You're frustrated. Your skin is a different color. Can you imagine getting a tan for free? People pay to have that skin complexion. You have the skin. You have skin. I was gonna take a picture. I'm like, people be paying for that skin complexion.
Yes, and it's crazy going through all that, and those people are going through all that we don't even know.
I mean, as I was writing all these things, I was getting like a little worried. But we have interesting. Anyway.
No, God, please don't.
No, I'm fine. I went to the clinic. It's just kind of like, oh, you're stressed.
Of course you are. You better be with all these. Oh my God, you cannot be.
Well, the thing is that the stress is even worse because I've been through this before.
Oh Lord.
We're still recording. Let's see, can you still see it? You can see it, right?
Yeah.
Yes, fantastic. Fantastic. Do we have any?
Okay. It's really good.
It's just wet.
Okay. It's better than nothing. It's full of ethereal and stuff there.
Oh my gosh. Stop. Anyway, so we're not done with number one. No. Number one has you have to think about it a lot.
This is kind of like the battle.
That's why I think that's why they do not put. Yes, you're thinking about battle because when you think about battle, you're thinking about what you will do for this patient, right? Because it's not much in the textbook because the textbook focus more on battle and she's not focusing on battle. So let me she assumes that because of battle, no.
Because we're supposed to know this. Because we didn't.
Because this happens before. It happens a lot, right? Don't remember what happened in AKI. I was no times two. Anyway, the whole semester I was just relying on.
Now, did she ask about the stage? Did she?
What we care about is end stage. We don't. She doesn't ask about the stage like that.
Okay. But they asked about the percentage for the end stage.
We just need to
less than 15. Okay.
We just need to know the labs. We don't need to know the end stage itself. Okay. So, take a deep breath. All right. So what are we going to do for these patients? Now we know what it is. We know what's going on. Now I want you to
give medication or diet or exercise.
So there's a lot of patient education that happens here.
Is it too wet? I can use my mask.
No, don't use your mask. I think I have tissue in my bag.
Oh yeah, I think I have to too. Look, if you don't find it, then I will add more. You have it?
I literally ate before I came here. Why am I hungry?
Because you're studying and talking and
no, I'm fat. I need to lose weight. I beg. I'm 186 pounds. I know I don't look like my weight. I know. I have one of those
you talk, so let it go.
No, I beg. I want to lose weight. I can feel it in my chest. I can feel it.
You will come.
I will lose the weight after I lost in school. To be honest, I'm not gonna lie to you. Like 3 months, like after nursing school, I always like lose like 10 pounds. It's ridiculous.
Why? You were supposed to gain after the school.
Stress makes me gain weight.
Oh Lord.
Cortisol makes you gain weight, and I'm eating sugar. So whenever I'm not stressed, I'm not eating sugar. I'm not even remembering to eat, so I'll lose the weight. I can't wait for my nurse's salary.
Then
Don't
don't worry.
working out.
Don't worry. You will lose all of that.
Amen. I receive it in Jesus' name. Anyway, one of my friends, she forgot that this is the last day to do the ATI.
Well, actually, they give us till Monday.
They did,
Yes.
but I'm glad that I told her to do it because I was seeing
Yes. Yeah.
I was
It's better
seeing
for her
this
to
thing.
do it.
Because the remediation is due.
Because you're going to do the remediation. You better.
And it's due this Monday as well.
Yes.
So even if you did, you're going to do it at least.
All those things. So it's better for her to do it so she has a weekend to think about it and do whatever.
Even if you did not do well,
Yeah.
doesn't matter.
I don't want to wish it the last day. Trust me, no, I don't want that stress. No.
No. The point is that there were lots of things happening. And we go to the same church. So like there are a lot of things happening, and the church is kind of like, come to church. My guy, we have nurses.
Yeah.
But to be honest, there are 3 other graduating nurses.
In the church?
Even our pastor is a nurse.
Okay, so he will understand.
Alright. So now we're talking about, okay, so think about what happens. Edema, you have all these things going on. Think about nursing interventions. We also need to know a little bit of complications, but we'll come to that later. Okay. So, we give meds. Right?
Do we have to know the meds?
Yes, we do.
Like CBC, ACEs, and stuff?
We will. It's in the thing.
Mm-hmm.
It's in the.
PowerPoint?
No, it's in the. Learning objectives.
Pharmacological and non-pharmacological.
So let's talk about nutritional therapy real quick.
Yes.
Because that's the most of the nursing intervention. We can talk about non-pharmacological, but that one will focus more on hemodialysis and everything, right? We talk about nutrition. So we give meds. Right? Let's talk about nutritional therapy. Well, this is the most important. Right? This is education upon education.
Yeah.
So, what about nutritional therapy? Do we need our patients to know?
Like to avoid eating too much sodium, like 2 to 3 grams.
So we want to sodium?
Yeah.
Okay. So let's say restrict.
Okay, sodium.
I know she said regulate, it doesn't matter.
Because sodium is low. So
restrict sodium. No? Sodium is low?
Yes, sodium is usually low. Okay. But that's why she said regulate, because it's not that bad.
Because some people need protein, to be honest. Okay. So let's say regulate. Okay. That's what she said. Well, she knows what she's doing. She's a professor. The book says restrict, but whatever. If she says regulate. Regulation of what? Protein. So typically 8. 6 to 8 what?
The normal is in the thing. It says the normal protein level should be 6 to 8. So it's usually more.
Right. So the protein should be about 1.2 to 1.3 grams per kg. Isn't that the what?
Okay, then when it's high, why is in the PowerPoint also 6 to 8?
Let's check now. Confirm. No, check.
Because I saw there was a table. See, it's urine protein.
So
that would be the urine. That protein and this protein, what is the difference?
That one is what you eat. Okay. Oh, this one is what is in
when it's broken
urine.
down.
This one is in the urine.
Because I was always thinking about this. Okay. Okay. So that is what we're going to eat, 1.2 to 1.3 grams.
Yes. This is especially important with dialysis. Right?
Okay. And sodium will be 2 to 3 grams.
So we have sodium. kg, right?
Yeah.
Okay. Yeah, whenever you want to increase it though. This more. We don't know the exact.
But there's a, yeah.
We don't know the exact.
Yes, not the values, but we have to watch for restrictions. Okay.
Right?
Then put restrictions because I think it's better to put restrictions than regulation.
So I'll put R here. We'll probably restrict. Right?
Yes.
And we'll probably restrict this one as well.
Yes, and then potassium.
This one, we don't know.
That one we can regulate, but the potassium we have because it's usually high.
Yeah, you're right.
And with dyslipidemia,
so but it depends because some people after hemodialysis they need things, right?
They even added for I think peritoneal dialysis they add potassium too.
So fluid should be 500
to 600. Plus the what do they mean by that? With the other day or something?
So
the last day.
So like plus yesterday's.
What does it mean?
So if patient, okay, so one thing. If patient peed, the patient peeing is impaired, right? If patient peed 200 ml the whole of yesterday, the patient is only allowed to have
500 to
700 to 800 ml today.
So if the patient had 500 ml yesterday, then today it's going to be the 500 plus the so it'll be 1,000.
So to be an 1 liter. 1 liter or 1.110. 1.1 liters tomorrow.
Okay.
You see what I mean? Does it make sense?
Okay.
Because you are allowed to retain this amount.
Okay.
It's not painful if you retain this amount. Okay. So if your body is releasing this, you're retaining this from the other day, and then your body now releases this, then you can retain this amount. Right? Because you want it to increase.
Okay.
Because your body, you definitely normally this is the deficit between I and O. This is normally deficit between I and O. If the patient's output is increased than this is a problem, isn't it?
So how do we even know the input then?
The output?
This is the output. Isn't this the output?
No, this is what you can take.
Take in, okay.
If this is what you can take, right? Because this is the output. So now, because normally if a patient comes in for renal issues, what do? We ask them to pee the bedpan or in a urinal. When they are peeing in urinal, or we use the Purex. And then when they are peeing and they take the Purex, we measure it. So okay, this patient took this, took that, took this, and we know the amount of fluid that patient has taken. Because normally the nutrition pamphlet will report to us that this is what you are giving this patient to
the nurses do that.
Well, CNAs. The CNAs
do they really do that because of that?
They do. Yeah. Because you know what they do? You don't want to talk to CNAs like that. That's what they do. They do. That's what they do. That's why they chart a lot. Mostly charting INOs for all their 20 patients. 4 times.
Okay, thank you. I was like, I used the thing.
I know it's confusing. Right? What else?
Phosphorus? No?
Don't worry about
they
it.
only use
because
binders.
We normally use meds. Because what if you're taking greens for calcium, you're going to take phosphorus with it. Right? You can't really stop them from taking the food that they need to take.
So this is basically the food part. The
Yes.
nutritional. Okay.
Yes. So next one, we're talking about assess fluid status. So how do we do that? How do we assess fluid status? Right? 80.
Okay.
That's the biggest, right?
Output.
High and lows. Right? That's another one. Right?
Yes.
So we also
Like
want to
check the weight.
how often do you take weight?
I think daily.
Yes, ma'am.
Same clothes, same time.
It's better you say well, patients normally whether hideous will roll anyway, so
Leave them alone.
it's disgusting.
It's so not nice.
Okay. So promote positive feelings. Patient is going through a lot. They can't have sex with their husband. They're laughing at me.
Then I go, no.
They can't have sex with their husband or wife. You know?
That's
Their
a
wife
break time. Take it as a break time. Okay, let's do.
And the time I know they do you, they do me. It bothers me if I can't have sex, okay? Thank you.
Well,
I'm already
you
strong
forgot
woman.
that you take breaks. You're supposed to take breaks. You can't be doing that all
Oh,
the
this is
time.
an extended break.
Oh my Lord, help me.
It's an you might have this break for the rest of your life.
No.
Okay.
So tell him to go, God forbid, but to go get dialysis done or renal whatever.
Yeah, but just decrease your.
Even if you do the transplantation.
It might not. It might never come back.
Fine, it won't happen. Okay, it's
God
not you.
forbid.
Good.
But the patient is going through a lot.
That's bad though. So this is mostly for men because women, you know,
I mean, we're not at risk for it, are we?
no, we don't have any problem. I mean, if you don't feel anything, that's fine, but it doesn't really hurt. So
what else?
anxiety, you mean then?
So we talk about provide calming.
Do you provide a calming place to find or not? Like, does it really matter? Like calming, like calm.
Well, if you have all the LOC, you definitely provide a calm environment. Right? You're restless. You have everything pushing up to your brain. You need the rest, please. Right? So you have do this.
So we give them the options. We tell them the options. Are we allowed to tell them the options, or the doctor will do?
We can.
Okay.
Normally, the doctor will come ahead. We support the doctor. Because even if you come and tell them, they won't listen to us until the doctor comes. You know this already.
That's true. That is true.
Well, now we know how women feel in society, quote unquote. Even though I'm not delivering. Anyway. So, probably have hemodialysis, right? So we avoid many puncture. Why is the handwriting looking so good today? Anyway.
Why?
My handwriting is looking better today. Anyway. Many puncture
And BP. Okay. That like we're telling them those things, right? If they have like
if they're checking your blood pressure at home, don't do it on that hand. With access device. Right? Okay. Next one. We need to monitor and educate on worsening
signs.
The signs? Yes, worsening signs and symptoms of renal failure. Right, which are
Bacteria,
That's the most obvious one, right? Decrease
fetal
urine.
like the smelling of the urine, the
I
brain.
mean, that's a given. Well, but yes, you're right. So
I
that's
didn't like that so much. I don't know questions.
it's so messed up. Ammonia, breath. Don't worry, I have a lot of questions for the second exam.
Okay, bring them on because really we have to do that.
Yes.
Big time.
But I will do that with the last one.
Okay, the last one.
Okay, so we also want to monitor for hyper. Yeah. So what do we monitor for, right? Muscle. Remember,
Weakness.
muscle weakness. What else?
Diaphoresis.
Diarrhea.
Oh, great.
So think about it now. Your whole intestine is a long muscle.
Mm-hmm.
Your whole intestine is a long muscle, right?
Mm-hmm.
So you have abdominal.
Cranking.
Oh Jesus, am I okay?
You okay? You can. How do you take it? A chair.
No, it's fine. I want to stand because if I don't stand, I don't know what's going on.
What happened? How you feeling?
My chest hurts. So
Should I assess you right now or what?
I have assessed myself and I'm going to the clinic. My blood pressure is normal as well. My pulse rate.
You were supposed to rest, Amara. Not coming here.
No, it's fine. I need to study.
Look at you, and your chest is racing.
My chest is not racing, it hurts.
Hey, my lord, even better.
I know you're panicking because of MI.
Amara.
I don't have MI, Rosa. Don't worry. I'm gonna go rest when I go back home. I slept today. I slept a long time
Yeah,
today.
it doesn't matter. You, if your body is talking to you, you need to listen to the body.
I don't know what to do to rest. I've been trying to sleep. I've been sleeping.
Stay in the bed, please.
No, I need to work out. I'm gaining weight.
Look at her, Amara.
God,
please
me.
have mercy. Please, oh, have mercy, because she's scaring me right now. Don't do that. If your heart is, especially you have pain, you need to rest so that you don't waste too much oxygen and all those stuff.
My oxygen is fine.
And look at us in this closed room. You need more oxygen.
I'm fine.
I'm going to be praying every second now.
No, thank God that I'm giving you an opportunity to pray. Amen. Hallelujah. Anyway.
And it's scary too.
Right. Okay, since our lovely Miss says I should sit down, I'm gonna sit down.
Yes.
Alright. What next? What is the next one?
Ooh. You good?
Yes,
Amara.
I'm just doing it really quickly.
Well, how is your foot? I'm not looking at that. I'm looking at. I'm carrying.
It's fine. I'm fine. I'm fine.
Yeah, Belle, please.
I'm fine. Anyway, what next?
So, which one? Amara, don't do this. Now you're scaring me so much.
Focus.
So, nursing intervention. So they have like the pharmacological and non-pharmacological.
What's the second one?
The second is a lab and the clinical
Bingo.
manifestations.
Exactly. Madam, please open your PowerPoint. So let's talk about labs. Right?
Yes.
Don't worry, it's a chair here. I'll sit down when I need to. Let's talk about labs.
Yes.
So what's the first two things that's going to be affected?
The creatinine and body. And she said something that like creatinine is the most one that they focus on.
Yes. So what is creatinine?
The level, the normal?
No. What happens to creatinine?
It increases. Those two increase.
So it increases. Right?
Yes.
So what is the normal?
The The normal is
Should think about this bit.
0.5.
Around. It should be around 1.
Okay, so
It should be. I should be able to round it up to 1.
Okay.
Right.
So it would
it's
be 0.5 to 1.2. They changed the
5
values. It
to
was
1. Because earlier it was 1
0.7 to 1.4. And I was like, okay, 7 times 2 will be 14. So it's like, that's how I put it in my mind.
Exactly. But normal lava, just think about it around 1. Right? If it's around 1,
That's good.
because the patient is like a 1.4, they're fine. I mean, it's like a, right? It's fine. But when, if I now can round up to 2, there's a problem. Because normally they'll give us like 2,
Okay.
1.5, 3, 4, 6.
Okay, so
answer the question with 6.
Theory of
they're not going to be me. If you can round up to 2, that's a problem. So just know it's around 1.
Okay.
You have to be able to round up. So 0.5, okay.
That you can
0.8
is 2. After 0.5, then you're done.
After 0.5, no. So B1 should be what?
B1 should be 8 to 21.
8.
Yeah, that's what they put. It was not that.
It's nobody around 20. It's 18 to 21. I was thinking that this woman. So let's just say it's 8 to 1, right?
I had to force my brain to accept those values. Like,
so it's
really
8 to 21. 8 to 21.
Yeah.
Right?
And
what happens to B and B1? No, they give us the values on
thank God. Thank God.
So what happens to B1?
It increases too.
Bingo. So we have 8 to 21. So it should be 22. And say, no, they give you 26. So you know it should be around 20. Right?
Yes. And then potassium. So that values.
So what happens to potassium?
It increases big time.
And what's the normal level? 3.5 to 4.5.
Yeah. 2.5, Missy. Oh my God, it's too easy. It's so easy that Amara 5.0. 5.0.
It was testing. I was testing.
Thank you for testing me.
I was testing. I was thinking 145. So what else?
And then phosphorus.
No.
She said
no. The reason why I'm going through this is because it's to remind you of the other thing, right? Because you're gonna see it. You're gonna see it. You're gonna see sodium.
Okay.
So what happens to
But it decreases.
What's normal sodium?
135 to 1.45.
135 to 145.
Mm-hmm.
135, 145. Okay. Right? Mm-hmm. So now we have phosphorus, the big boy.
Yeah, it increases.
What's the normal phosphorus rate?
2.5 to 4.5.
2.5 to 4.5. 4.5. And what next?
Calcium. It decreases. So 8.2 to 10.2.
It's supposed to be 10 points. It's supposed to be
8.2 to 10.2.
It's supposed to be 8 to 10.
Wow.
Oh, this so bad.
My brain. Trust me, I'm like, okay, fine.
Just know it shouldn't be more than 10.
And so the ABGs.
Do we need to do the ABGs?
I mean, she put those in there. She put the pH.
Yeah, because normally we have metabolic acidosis. Mm-hmm. Right? Because uremia is an acid.
It's an acid.
So metabolic acidosis. So let me write here.
That's when we need the buffer thing.
Yes. So what would
the normal rate is
pH? What will happen to our pH?
It will decrease.
There's a reason I'm using all these arrows. So you know it's high, right? So pH will decrease, right?
Yeah.
Right? So that's 7.3.
So it will be lower than 3.5.
Probably be like 7.32, 7.3, 7.33. But they never really do 7.34, right?
It's too close to
It's too close to normal. And they know patient, they know how their students take out. They know we overthinking.
We are scared.
Anyway, right?
Yeah.
Okay.
And
The
the
GFR
GFR.
will be low. Who produces the bicarbonate?
Who?
Who produces bicarbonate? Who produces it?
The fact that
Who produces bicarbonate? Which part of your body produces bicarbonate?
the body, the
Kidneys.
belly, the kidney.
The kidney produces bicarbonate.
The kidney produces bicarbonate. They're high though. If they're not, well, okay, fine, they're low.
When bicarbonate
Because
is
it's not
alkaline.
food.
Bicarbonate is alkaline, so it goes low.
So what produces? Who produces the pH then? The pH is just a normal thing in the body.
Yeah, because so basically this is low. This normally pushes it up to here. So if this is low, plus you now have uremia, what happens?
So total acidosis.
Okay, let's talk about blood urea, right? Let's see.
What about the GFR? Is it part of this?
Yes. We'll talk about GFR. So let me see. This is what causes it, right? What happens to blood urea?
It will be high though.
What's normal?
Urea level. Did they give it to us?
Yes, ma'am.
When?
So it's not urea. Sorry, I meant to say blood protein. I'm sorry.
Okay, blood protein would be then 6 or 8.
Is it blood protein or urine protein?
Urine, gee, oh my gosh.
I just knew it was something.
Yeah.
That's really
Because you see, I was confusing
I was confusing it too.
Okay. I was like, now I have to remember you have the urine protein and then you have normal protein that we eat in the food.
Yes.
So the urine protein would be 6 to 8. That would be the normal value.
Yes.
So it would be
So
high.
let's go back up to urine protein.
Because of urea, because of high level of urea, the protein is not broken down.
So it should be high, right?
Yeah.
What's the normal?
6 to 8 gram per deciliter.
Who cares? Just make 68. Alright? What else?
GFR.
What do you want? Higher or lower?
It's lower.
What do we want?
We want higher. Oh yeah, we all want higher.
Exactly, right?
Yes.
So it will decrease. So it will be less than?
Less than 90. But in her thing, she said the normal value, the normal range is 88 to 137. So 88 is lower than.
Is that included?
It's 88 is lower than 90. So I don't know, but I know that it has to be
Are you
over
sure
90.
that's the same thing?
Yes.
GFR? Creatinine clearance and GFR is the same thing? I don't know. I'm not sure because I'm looking at it, I'm getting confused.
It should. Okay, fine. I will. Look
Because
into that.
textbook says 90.
Let's keep 90.
If textbook
It has
says
to be over 90. I know, but
It has to be
she
over
said
90.
it's 88 to 137. So.
yeah. So let's put it here, right?
Yes. I'm going to email her. Just
Yeah, because this can run up to 90.
GFR and creatinine clearance. I will email her. I will let you guys know.
Okay, please stop. What else?
And hemoglobin and hematocrit. So
Yeah.
I have to remember
So
the
H
sex ones, like male and female.
H. It's around the same thing. H and H. It's around the same thing for both. Right, so H and H. What's up? H and H?
It will decrease.
Both hemoglobin and hematocrit?
Well, because it says
If one decreases, the other
it
decreases.
says age, if hemoglobin and hematocrit, they will decrease.
So they
these are
both
the
decrease.
Yeah, these are the normal ones.
So we now have. So let me say
for male,
HG. Male, what is it?
For males, it's 13.2 to 17.3 grams per deciliter, and hematocrit is
Wait,
well,
let's
for
talk about
female
this.
it's 11.7 to 15.5.
It's about the same thing.
So they are saying if it's around 12 in the book,
So we're
then
looking
it's
around
fine.
12.
Yeah.
So 12 is good.
If it's 12 and
If
up,
it's so we want it. If it's so we're looking for less than 12. This is what we're looking for.
for that
For
thing.
both of them. We're looking for less than 12.
Right.
If you're thinking about,
So if it's
you know
less
what,
than
let me write
12,
it
then
here.
it's
Let me write it here. Right? So then we have hematocrit.
hematocrit
Let me
for
write that underneath here. Okay. Hematocrit.
for male is 43 to 49%. It's in the 40s. And then for females, it's 38 to 44%. I think in the book they were saying if it's like over 33, then it will be, if it's less than 33, then it's not good.
Right?
Yes.
So you're looking at less than 33. So keep these numbers in mind. Less than 12, less than 33. We can holler them and say that's what the book says. But check again, confirm.
I will.
Do you have it here?
It is somewhere here. I have to find it.
Take your time.
I saw it somewhere here. Here, you can look too. This is what I think with me. It's not like highlighted and stuff. Dialysis is here.
No, that, I'm saying that's dialysis, so I'm not
Yes.
looking at that.
Okay. I know I saw it somewhere. I will find it and
The lab's supposed to be somewhere. I'm at AKI, right? So they say the church should be founded. Okay, so
You
I
found
see
it?
this surround this area.
You found it? Let it be here.
Should be here. So because I found calcium in 2006. It just says low. Doesn't say anything. Okay,
When I find it,
oh, it says hematocrit less than 30.
okay, less than 30.
Hematocrit less than 30 is when you do erythropoiesis.
So that's what it's waiting.
What it says. Hematocrit less than
But
30.
see, so hematocrit to achieve 33 to 38. So this is what we want. 30, at least 33 to 38.
So okay, so we want. So what are we looking?
We are looking for 30, at least 33 to 38.
So I'm saying it shouldn't be lower than 33.
No.
Okay.
So if it's
So you were right. You remember that one.
Right.
Right?
I'm still doubting and thinking.
All right. What else do we need to know?
I think that's all.
Okay, let me write this down here for remembrance. Right? So when this is 30%, we give erythropoiesis.
Oh, Epogen. I go with Epogen. It's easier for me.
Sorry?
I go with Epogen. It's easier for me. Epogen is a brand name though, but erythropoietin
Yeah, but no,
alpha.
don't ask you for brand name.
Okay, fine. Erythropoietin alpha. Or EPA. That's their group. No, don't clean it. Don't clean it so we can remember. Yeah. Yes.
All right.
So we can remember.
Actually, I've got an article. Thirsty. Anyway,
I have a full bottle of water,
please.
but it's a huge one.
Please.
Actually, you need that because your heart.
My heart and my chest.
Your chest is from what? Isn't it your heart?
You
Is
can
it
also
your
be for my
lungs?
lungs. You can also be for my lungs. This is interesting.
Let's be beautiful and make sure that water clears that pain away.
Oh, that feels better.
Thank God.
Anyway, it's just the weather that is doing it. That's it. Really.
Why are you doing this? Please don't do this.
Oh no, what is my name? I'm just working and trying to pay my rent. The groceries is
Still,
working.
like, find time to rest. Because you
I
need to
rest in
leave
the
before
night.
you pay your rent, right? Hey, mama.
Don't worry, Rose. I'm fine.
She is too much. She has to rest. Somehow.
I am fine. Can you imagine? I forgot what third heart block looks like. I'm so mad.
On the exam?
Yeah. I
Oh.
forgot how it looked like. So I went to
You know, we're all stressed out and everything. Trust me, it's just
I didn't
crazy.
sleep well.
It's crazy. If you don't,
I was going on 3 hours sleep.
oh my god, you can't do
And
that.
I still got 31.
Actually, I only slept 5 hours. Trust me for the exam. I was being too nice to myself. It's usually like 3 hours or something like that.
Those kids on yours, God have mercy.
Hey! Did you see the picture? See her behind me, right? She was there squeezing me, sleeping right next to me. Like I was there
She
really
loves
like.
her mommy. She loves her mommy.
Yeah, too much. Yeah, too much.
All right, number
Okay.
3. You're going
So-
through. I told you this is not much. You've gone through number 1, number 2. You're halfway there.
So here, the non-pharmacological measures are the one we did. They are the nutrition thingies and
We did nutrition, but I'm going to focus on hemoperitoneal dialysis. Those are the ones that you really need to know. That's the one that she asked most questions in. So
the
read all,
and then the.
read all the charts. She likes charts.
What about the transplant? The number 5.
No, it's number 5, number 5.
Okay, so it's a big one. The pre-op and the post-op, basically.
No, pre-op and post-op, that's what we do, right? And then dietary modification, we talked about it already. Well, we'll return
It's
it,
the
so
same.
it's similar. So let's talk about farm. Let's talk about farm, baby. Let's talk about you and me.
Oh my God.
Okay.
This girl, when we graduate, something is going to happen on that thing there on that day.
I'll be like,
Oh, they're going to play one of your songs, Nigerian songs.
yo, I'll just be like,
Ah.
I'll just be like, hey.
Do we get to choose our things or
No,
they
no, it's the
choose?
same song.
Come
Same
on.
boring here.
They should change that. Okay. Let's stop
How
it.
many children are, how many people are graduating? How many songs can they truly play?
Well, we can bring our own songs.
But like, how can they cope?
When they call your name, they just put them together with the whatever they're going to post on the board. They can do that. Like once they call Amara, play. That's Amara stuff. Play. You know, it would be very much fun. Oh, you know what?
You should go and plan it for them.
I'm going to ask. I'm going to ask
No,
Professor Robinson. Maybe for the other people.
She'll be like, oh, that's so fun! And they never do it.
Oh Lord. Okay, fine.
Okay, farm. What are we looking for?
For farm, I
Calcium.
mean,
You didn't read?
CCBs. I didn't get the chance to read the Lily's book.
Okay, don't worry about it. Calcium and phosphorus program, because it's not that much that you need to.
We have in the book though. No, it is in the Lily book, right? It's not in the.
It's in the book.
Okay.
You don't need the Lily. The Lily is just a waste of time for that.
Is it?
No, it helps you understand, but they don't ask questions from Lily.
Okay.
So, calcium and phosphorus blockers.
Which page is it? Okay, I will find
I don't
it.
know.
I will find it.
I don't know. I just have my nice compiled notes here from the book. And I know this is from the book. I don't care anymore.
You got that from the book?
Yes.
Okay.
So, we have the calcium. So, whatever, think about it this way. We have calcium, right? So, the examples that come out is calcium. Ah, I love this marker so much. Calcium. Mechon.
You haven't missed it, that's all, Mama. That was very stretched.
What?
The that you just did, it was really stretched. That is 100% from Africa.
I am African. I wasn't raised here, remember?
Oh, Lord.
I wasn't raised here. So, we have calcium carbonate, calcium acetate.
Okay.
Right?
And when they said something about
And then there's one more.
yeah, the cell mirror or something like that. Cell mirror. So the 7-lab mirror is only if, right? They said if the binding is like about 55%, something like that, then they need to use the 7.
Okay, let's look at it.
7-lab mirror.
So if it comes to your brain, throw it out. That's what you're both studying, right?
Yes, yeah. So, such as calcium carbonate or calcium acetate as prescribed, but there is a risk of hypercalcemia. So if calcium is high or calcium phosphorus product exceeds 55, so if it's over 55
So let's say
milligrams,
if calcium
dash
is
phosphorus,
high,
calcium is phosphorus, both.
or both calcium, I'm tired of writing in calcium, right? Calcium and phosphorus combined are 55.
Yeah.
We use this.
Yes, it's a polymeric phosphate binder.
Okay?
Yes.
Wonderful.
So you
for
take it, how do you take it? They put the
okay, so one thing that's here with all these three, don't take magnesium antacids.
Magnesium based antibiotic to prevent toxicity. Magnesium toxicity. And the binder, they are saying that the servomere is taking 1 to 4 tablets with food to be effective.
Are we happy?
Mm-hmm.
You think you're done with this?
Yes, ma'am.
Okay. Well, this one is definitely coming like an exam. It will definitely this
magnesium thingy
right here. Right here is
the
not
eyes are
between
very big.
meeting the ankles. Right here, it's so big. It's
don't scare Rosa like your eyes are.
Okay. Right.
Oh,
what next?
Okay. Okay, antibiotics. Hypertensive, okay. Which ones?
Because you have to control the fluids, right?
Do they give any name?
Don't worry about it, baby girl. I got you.
Okay.
Okay.
So we have like furosemide and all those.
Mm-hmm.
Okay. And CCBs? Templeton, nothing cool. Toxicity. Okay, the vitamin is 4. Check. Yeah, I remember we got it in the dysrhythmia too. I think I checked with that.
The vitamin speeds up heart rate.
It's really heart failure and helps the heart pump blood. Okay.
Mm-hmm.
So the blood can
helps the blood move around.
Yes.
So is there anything that we need to know for this one?
I think this is okay.
Check.
What about anti seizures?
Amen. That was the next one.
Okay. So you have you have diazepam and phentoin.
Fentanyl.
Okay, fine. IV diazepam and phentoin. I never like to say fentanyl, but it's fentanyl when you read
It's
it.
fentanyl.
There's no nin though.
Fentanyl.
Fentanyl. Fentanyl.
Fentanyl. Fentanyl. I know. In the English language is complicated.
The pronunciation.
Bro, English language pronounces OUGF differently. Do, enough. Okay. I also plan. And
Like, but so huge. It's HUGH or something like GS or something like that, but the way you pronounce it.
so there's a question that comes up, I remember it clearly, where she talks about what medicine you give, and it's a circle.
What? Who? What do you give?
She just asks you what medicine you give. Circle apply.
Select all that apply.
Cry. Cry.
Oh no.
Are we crying?
I don't like select all that apply.
Yeah, let's sorry. Kiloshe. Do you want to hug you?
And
You want a kiss? I'll go and call your husband for you. Fuck you.
you will.
Okay, stop showing off. We get it.
Oh my God. Oh Lord. Help me. Oh, you're going to have so much that you're going to run away from it. Don't worry. It's coming.
Please, God.
It's coming. Oh, it's coming. You're going to be like, God help me. Oh, I asked now. I'm tired.
Alright.
So erythropoietin.
So let me close this one up. Let me do this one. Alright? It's ugly. Okay. There we go.
So the
Right, erythropoietin.
Yes,
When do
the
we
big
give
one.
it?
When the
So we give it for anemia.
and then when the hematocrit is lower than 30.
CT less than 30%. Right?
Yes.
Okay, so what do we give? So normally we give it IV or subcute. Right? How often do we give it?
We give you
3 times.
3 times a week, and for 2 to 6 months. Yeah, I think
For 2 to 6
it's weeks. Lord help me. It's not months.
So what are the adverse effects?
Hypertension, seizures, increased clotting.
HCN.
So it's weeks, they're all weeks, okay.
So what do you need to keep an eye on, right?
You need to keep an eye on your iron because it lowers the iron level.
What's the normal iron level?
Mm,
Don't worry, you don't need to know. Don't really care.
I have to look for that.
You don't really need to know. Trust me, you don't.
Okay.
Okay.
So if the iron level is low, we need to supplement, then like give iron supplements.
Mhm.
Like when you're giving this, since it lowers the iron level, supplementary iron may be prescribed.
So we give what? Okay.
They have like some names here, but I think with supplement iron is Venifor, Dexferon, Ferric.
It has fer in it. Just
Yeah.
know. It has FER in it. Right. So we'll talk about dialysis soon. Let's take a picture. Before we talk about dialysis, I want to talk about what causes it.
What causes the dialysis?
No, what causes this whole mess in the first place? Okay. So I need to get this one.
Do we give statins too?
No.
No?
Statin is a kidney injury. Statin is there's no lipidemia issue here.
So hypertension and DM only. So we don't give anything for sugar? No?
No, we give insulin for potassium. Oh yes, let me write that down. Let me write that down. This is
So
because you talk about it,
potassium?
right? Yes, because insulin decreases.
There's something else too. For potassium, we give not only insulin, but we give Kayexalate also. And one more. It was like three things.
How do you spell
Kaye X.
Kaye?
Yes, X. Salad. A Alate. Yes.
Whatever it is looks like it starts with a K, right? Also decreases
Yes.
potassium. What else?
There was a third one. I forgot how to find it. I have to find it on this file somewhere. I'm coming out.
No, take your time.
I am tired, Mama. I am tired.
I'm literally yawning and I'm looking at you.
So insulin, chiacide, and then calcium gluconate there. Calcium gluconate. Those three can lower potassium. So also, we can give blood transfusions for extreme cases of anemia. We can put it on the, just in case so we can remember. Okay, but and also remember for the insulin, it has to be the regular insulin, not all insulins. She really mentioned that. I know they will trick us for that, for sure.
So extreme.
A case of anemia, then we give that's all. That's all. We give blood transfusion, but I don't know if they're going to ask anything about blood transfusion.
Okay.
What do we do for blood transfusion?
Oh, praise God. Give me a second. Let me pause this recording for a second. Even if it's online.
Like they are going to be doing this.
Even if it's online, because this is more helpful than studying by yourself, to be honest. My own experience, though. Right? So talk about
we always share things, so it's always better to study together.
Even if you're just praying together, then it is better than. Oh, Jesus. Jesus,
we need to do. So for the squeezes, what do you use? You only use Quizlet?
I use Quizlet to study. I talk about the ATI comprehensive.
Where do you go? The comprehensive?
No. Don't worry. I have PowerPoint from an older person. So I'll go.
But they have
the plan is to go through the PowerPoint together, because it's everything for the next exam.
Okay.
That's why I want to let's just study.
Yeah, but what
the week of the exam, we just go through those PowerPoints.
Like, so what does the PowerPoint have?
Everything. All the topics.
Okay.
All the topics. GI, shock, and all that.
But that would be for the finals then.
No, the GI is for the second exam.
So everything for the second exam?
Yes,
like you have
everything
a PowerPoint
for the
for
second.
that.
Yes. So it's like a second exam testing. Please, I pray that do you know last exam? Do you know the remediation?
So we can go over it?
No, we are doing it to get that. I'm looking at you, Rosa, too. I'm looking at you to get that.
You have to give her a heart attack or a chest spin or something.
I don't get
with your big eyes now.
My beautiful big eyes. Oh. If only men stop hitting on me in the bus stop.
Please, for them.
I want to attract good men, not the trash that I attract anyway.
God will give you who is right for you.
Amen. Don't worry, you think I'm tired of it.
What did you drink today?
You don't know
just
what
water.
You don't know what I'm going through.
Okay, you will pass.
I drank coffee this morning.
Oh, no good.
That's probably what's making my chest hurt. Me drinking coffee this morning.
She passed, right? I think I know her.
Samuela?
Yeah.
She passed at 98%. 96%.
On the exam?
That she didn't study for. But I want to get all of my shut up.
On the exam,
she went to get 100.
Exam 1?
No, exam 1, she got the same thing as you.
Okay.
She got the same thing as you. Don't worry. So we're talking about non-farm. Yay! Are we excited?
I want somebody who got an A so they can tell me what they did. Well,
no, people who got nobody. The highest is a 35. Just 35 to 6. People who got an A did well on the sample apply. That's all people is missing. That's all that's missing. So I have to go apply.
They don't give half. Okay, fine.
If they gave half, do you know how many people will be passing us in school?
Yes.
Anyway.
They
They care more about weeding us out than actually ensuring the student passed.
But on the NCLEX they give half, right? They give points.
Yes, they give partial credit.
Okay, that's fine. I'm not going to hit the anymore.
NCLEX is easier. That's why my friend went to do. Rosa, don't waste. I'm telling you to don't waste your time waiting in the FS. First thing you can do is do it the next day. What are you going to study for?
Next day? How you
After
going
you
the
it's
and all
not.
that?
It's not that. It's not the content. It's not the content that actually hurts you. It's how you answer the questions that hurt you.
How?
Like for instance, now when the exam did it matter about how you what you knew? If you pass 4 semesters, you can pass the entrance, and it's better you do it as soon as
So,
possible.
but the thing is, you have to remember the things since the first semester. That's the only
Mhm.
thing.
You
Like,
yeah.
you know,
If you do the comprehensive over and over again, you pass the entrance. If you do those comprehensive exams over and over again,
comprehensive.
yes.
Yeah.
If you do your board bites over and over again, you'll pass. You work. The things that it doesn't matter whether you're doing well or not. It matters whether you can answer the questions now. Because what's happening is that they're asking you how you think, not what you know. Because even if you don't know, if you're thinking the right way, you figure it out.
That is the thing, like how to think the right way. Because sometimes
That's what I'm saying. It's more important for you to answer. Like before, like that's what I'm saying. Before I do my NCLEX, right? And while I'm waiting for my acceptance letter by the grace of God, I'll just be answering questions all the time. Just be answering questions. Even if it's 10 questions a day, I just be answering
From
questions.
where?
You have your phone. You can answer questions.
Any
on your
questions?
phone. Any NCLEX, it doesn't matter. It's not all NCLEX. Just answer. Even if it's not standard, you go and answer. Answer all the questions. Be answering questions. Even if you just, when you go back home, you cannot do board vitals. Answer all the questions. If you want to go and pay the money for you, go ahead and pay the money for you. I'm not. Answer question.
Somebody, a nurse, I was asking a nurse last time, she said that she used Kaplan or Kaplan.
People are telling me
and then
that
she used, and then like you said, she was just answering questions, that about NCLEX. She goes online and look for questions and then she just answers.
Because and then you read the rationale. Even if you don't read it, you don't get it. If you don't get it, write it down. Write it down.
Okay.
Non-farm. You're talking about dialysis.
Those are the non-farms.
This is very important because she will ask you questions.
Oh, I'm sure.
So we have hemo. You know what dialysis does.
Yes.
Right?
Doctors.
We
It's
have
the kidney, the artificial kidney.
Exactly. So we have the hemodialysis. So how often is it done?
3 days a week.
How long does it take?
3 to 5 hours.
Bingo. Right? Where can it be done?
Where? It can be done at the hospital or home. Like the outpatient. Yeah, you have to be experienced.
Okay. So, what do we do? Right? Okay. So what do we do before?
We check the vital
So
signs.
we are doing pre. So what do we do before?
Check the vital signs or assess.
What else do we do?
We listen for the breathing and we palpate for the throat.
You're actually really good. So when you feel okay, so what happens? It's literally like You know when you put your hand on the pipe. It's
Like,
like,
that's so weird.
and then when you hear the brew, it's
Yeah, it's really. They might even put something like that so we can distinguish between it. Oh my god.
no, brewage is feeling.
Yeah, like they can put like those noises even for the ATI thing. They put a note like if somebody was talking.
Yeah, someone's talking. But don't worry, in the final exam, you don't need to. You're not doing everything. Don't worry about it. Look at the time.
We have.
So what do we do again?
Do we weight them? I think it's for. Yeah, whole blood pressure medications.
What else?
And okay.
Heparin.
What's the risk for blood? Where do we give it?
You're playing with blood.
Subcute?
It doesn't matter.
Does I know?
It doesn't say IV. The book doesn't say IV.
For PD, we put the heparin in the dialysis. So I don't know if.
No, that's for P. That's for PD.
Yeah.
But this
one you give it.
It might be IV, it might be subcute, but I don't really know. It doesn't. I didn't really see the difference in the book. Okay. Just give heparin, sure. What else? If the patient's blood pressure is less than something, you don't give them.
If the blood pressure is less than 90 over 60, I think 90 over 60, you don't give. And also, it's better to hold, like you said, the BB med because when they go and for the dialysis, they have hypotension. So if you give the med, it's going to be even lower. So that's.
But if the patient's medicine is already like this, that's why we assess BS because we're looking for this.
Your blood pressure.
Don't give. If some hospitals
like if the patient drops no dialysis. So basically, if the blood pressure is lower already, you hold the dialysis. You don't.
You might give them a fluid to increase blood pressure if they really need it. You know, if it's really affecting them.
Okay.
But that depends on the doctor.
Yeah. Because it's not safe.
So what else? What else do you do before? All right. Don't give. Right? Don't give water soluble meds before.
Why? Right. Don't give water soluble because it will wash them all away. But fat soluble you can give. They will bind to the protein, the fat to albumin.
Restrict protein and fluids to reduce waste. Right? So what do we do post?
Restrict protein?
Yeah, to reduce waste. Only the filtering most of the time is waste. Right? So you don't really need to know much about CRRTs. Just know that it's for people who cannot handle hemodialysis. It's continuous hemodialysis.
Yes, for that, I'm always asking myself.
We use CRRTs later on in the semester.
Now how do you call the
So if the patient has a heat stroke, their kidneys are down. If the patient has is really poisoned, the kidneys are down.
Now, what is ultrafiltration?
Ultrafiltration?
That is part of hemodialysis too.
Yeah, but we don't really need to know that. They are like principles, right?
Because you talk about osmosis.
In ultrafiltration, ultrafiltration, fluids move under high pressure.
And it helps at that time because the get rid of the fluid at
Yeah, because proteins are heavy.
Mhm.
So proteins are heavy, blood is light.
Because it says
Okay, so let me read this what I wrote here, right? Diffusion, osmosis, ultrafiltration are the principles for HT. Toxins are removed by diffusion, moved from high concentration blood to low concentration, dialysis. Excess fluid is removed through osmosis from low concentration to high concentration. In ultrafiltration, fluids are moved under a high amount of pressure to an area of low pressure.
From high to low.
Yes. So ultrafiltration helps you get back your blood, right?
But it's quicker. I'm trying to find where they say something like that. Like,
so what is post, right? What's post?
Post dialysis.
So it's like allow the blood to be removed, cleansed, and returned to the body at a rapid rate of 300 to 800 ml per hour. Right?
That's ultrafiltration.
Yes.
The 300 and 800 that they put there, they can ask a question about that.
Okay. What do you want
Like just to know that we have those, because she was saying that we have a membrane. The dialysis is like the membrane that which is the kidney that filters the toxins.
Yes.
So you have the diffusion, osmosis, and ultrafiltration. So, like you just said, we just need to know those three principles. I think she didn't talk about it.
She doesn't even talk about it in the exam too. Doesn't really matter.
Okay.
Okay. So what are we talking about? Complications. What complications do we need to know? So we monitor for this. I'm writing this under post because it's also post, right? So I'll say post.
Post
Slash. Yeah, post slash complication. So what am I saying? Okay. So we have hyper, tri, glare.
See, that's why I was talking about the statins, but
Yeah, but you don't give statins.
okay.
I don't think you do.
So how
It
do you
hurts
treat
your
the
kidney.
triglycerides?
There are other anti-lipids than statins that are not kidney harmful.
So they probably give another medication, but
Like
it's
a digoxin.
Something like that. That lady, she was repeating statin. When we were doing the.
We don't give statins. Why are we giving statins? They hurt your kidneys.
Fine. Okay.
Is it in the book?
No, I think I saw something like that, but if I find something like that, I will
Please
let
text
you
it to
know
us.
because it stayed in my mind.
So cardio, vascular
Unless it's for aneurysm, but
disease. Maybe it's for aneurysm. You'll give statins for aneurysm.
I think it's probably for aneurysm. Because when we're doing
Anemia.
the word thingy, we talk about aneurysm too, so it's probably for aneurysm.
Uremia. So this is, you have blood loss and gastric ulcers. So this one shows up as metallic taste and nausea. Right?
And also the uremic factor thing, that's smelling.
No, that's not. We've gotten rid of that now. That's not really a problem right now.
Hypertension too.
Picture. No, we have hypotension. This is a complication of hemodialysis.
We have hypertension.
For hemodialysis?
Thank you. Okay, I am here. So you have cardiovascular disease. So cardiovascular disease is what?
It's just your heart being messy. It's not necessarily hypertension. It's because of triglycemia that affects your heart. So you will have hypertension.
So
but this one would affect the efficiency of your heart.
So at time of dialysis continues, calcification of major blood vessels has been reported and linked to hypertension and other complications. Okay, fine.
No, but we can write it down.
Let's just put it somewhere in our mind.
Okay, so each. So it's written down here, right? I'll have to write it down as well. So calcification of blood.
But it says hypotension too. They occur.
Yes,
because the fluid are removed.
So we now have hypotension. The reason I'm writing this is writing down intro and post because to help you, right? So this happens.
Did they ask about the complications?
Yes, they do ask about the complications. We don't need to know the complications, right? Muscle cramping. Why?
And Anna, just to let you know.
Yes, ma'am.
Oatmeal is high in phosphorus, and phosphorus, you know, it does with calcium. So
no oatmeal.
Even the milk.
I know oatmeal. I'm fine.
Think about your calcium level.
I don't drink oatmeal that often.
Okay, fine.
Before you get worried for me.
I'm worried already. I was thinking about it when I was reading about the phosphorus thing.
You're thinking about me and my obsession with
because yes. Okay, fine. So that's the parenthesis. Baby. Oh my gosh.
Okay, so it causes muscle cramping. Why?
Muscle cramp.
That's a complication.
For what?
Of hemodialysis.
Okay.
What happens?
Potassium tanks. Okay.
Potassium tanks. So this is severe blood loss. Right? Okay.
They said
dialysis. What?
In the book, it may occur if blood lines separate or dialysis needle become dislodged.
Severe blood loss.
No, the examination thing.
Yeah, severe blood loss. Okay. Yes. Because obviously you have to be looking and everything and checking what the patient is. So when patients during this dialysis, what do? You check him every 15 minutes.
Yeah.
Well, that's not that business. That's a dialysis business.
Is it for HD or PD?
HD. I'm still on HD. I'm not about to PD. PD has a different set of issues.
Yeah.
Guess what? This really means.
Get there. It's 54. You have 6 minutes.
Yes.
We don't want to stay on the stairs somewhere.
I don't think you're gonna get there. Let me finish.
We can finish.
Let's just finish this. Mm-hmm. So we know we have
peritoneal. We have HD, and then we have transplantation, and then we have renal trauma. Those three.
Transplantation?
Yeah, the kidney transplantation.
Yes.
And then kidney transplant, and then renal trauma. Those three things.
So it's not that much. Mm-hmm. That's what I'm saying. Can we meet on Thursday? Can we meet on Thursday? You're always there on Thursday, right? When do you come to the library on Thursday?
Thursday is the time block for me, but I can.
No, you don't have to.
No,
you don't have to. Okay, so on Friday.
No, you guys can meet on Thursday and send me the thing. But I will see what I can do.
No, don't worry about it.
If I can come, that's good. If I can come, then I will get it.
If she can come, that's good. If she cannot come, that's good. I'm always there. So
okay, fine. We'll see by Thursday.
We have chest pain
on Friday for sure.
Alright. We have air and
chest pain.
Yes, we do have chest pain, and we do have air embolism.
You mean SOB?
That's not shortness of breath. Is it SOB or chest pain?
It's SOB. Episodes of shortness of breath occur as fluid accumulates between dialysis treatments. Yeah, but they have painful cramping. They have chest pain. They have chest pain too.
That's not crazy.
Sorry, Mama. It occurs with anemia.
It occurs with anemia.
Or arteriosclerosis.
Atherosclerosis. So, okay, now let's talk about vascular access, which is part of.
Maybe you think about anemia too if you have chest pain.
We talked about.
Check your I'm talking about you. Check your.
I probably do have anemia. Yeah.
Okay, then please take your iron supplement.
I've been taking my supplements
every day.
I forget. So we have vascular accesses, right? So we have
Wow, let's go.
Okay.
Because you only have 3 minutes by the time we exit this room.
We have 10 minutes per day. So we have vascular access, right?
Yes.
So we have vascular access device, which is a large, large. So which is always is either in the subclavian, right? Internal or femoral vein. Okay, right? So we need to know what are the risks.
Did they ask question about the veins?
Yes, we do.
Where we put them?
No, but just need to know where they are. It's normally here, right? So the risk are hematoma,
thrombosis,
infection,
pneumothorax,
infection. What else?
Thrombosis.
Right? So let me just do this.
What are the risks for hemodialysis though? Not the complications, but the risk.
There's no risk. These are the risks. Risk is also complications. It's a complication you need to think about. So this is
usually those two things for HD infection and thrombosis. So they use the
So we're talking about, let's talk about AV fistula. Okay. Right? You know what it is. It's preferred. Everybody likes it. It's convenient, right? Because it's your body. Right? So an artery and a vein.
Connection to artery and vein.
Right? So what does it do? 2 to 3 months
to mature,
to heal. Right?
And then we have
patients exercise. Wait. Patient does arm exercise.
And also we need to remember that when they are going to do the dialysis, they have to. It's two parts. It's not just one. Like when you put 2 needles.
You put 2 needles in one.
Like you put one to the artery and one to the vein.
No, it's combined. So you just put one.
Somewhere, where did I read it? Like it's. I don't know if it's in the book. But
if it's not in the textbook, don't think about it.
Okay. I will.
No, you put 2.
Yes.
So what is the arterial blood comes out?
See, you put one to the blood. And
so you put. Okay.
There was a question about that. I'm like, I thought it was one because I'm saying, why do you combine both and then you're going to use separate? Like, what's the point? So
this one is preferred because it has the least risks. Okay. So then, what's the next one?
The AV graph. It's 4.
right? Who is it for?
So it's for when they can't use a vein uh, for AV fistula, the DM2. Because DM destroys the veins, and then when the veins are not like, okay, no, keep saying it. When the veins are not, I don't know the term anymore. Like they can't use a vein.
They
then
can
they
use the
have
vein as
to.
well if they want to.
Okay, they have to put like artificial thing to link them.
Okay, so what are complications?
Infection, thrombosis, and what else? There was something specific.
Infection, right?
Stenosis there. That was specific to it. Stenosis.
Thrombosis. Two oses. And what do we do?
What do we do?
So for all of them?
Listen for the thrill and
all of them.
No, listen for the there we go.
So we are done with hemodialysis.
Yes, ma'am.
All right, Rosa, we'll see you next time. Stop. Yeah.